Right. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Ahlan wa sahlan. Welcome everybody to our third virtual birth circle. Now I started these virtual birth circles endish of last year. Then we had one in the beginning of this year, and then I promised one right after Ramadan, and here we are. Alhamdulillah. So first of all, a very welcome back to all those that have been joining all of the sessions so far. Just understand each of these are independent. It's not like something flowing into the other. So yeah, you're not missing out on anything as such. And the whole purpose of these are to come together and share, ask, feel supported, and in any part of the journey of motherhood you are at. All right, how to make the screen big. So if you're on your phone, you can just rotate the phone. So just make sure it's the rotation is unlocked. So make sure you're viewing it on a landscape instead of portrait. And that should make it easier, inshallah. Okay. All right. Alhamdulillah. I just want to explain how this whole thing works. I will not be answering questions right now. I'm going to give a link where everyone's going to be posting their questions, and those questions would get priority, just like in the search sharing. I just saw some of you sent some questions in the sharing box. Right now, it's just the sharing part. The question box is coming up. Just wait. All right, that's the purpose of all the day today. Okay, so without further ado, starting with introducing myself, because mashallah, I saw, because I see as people are joining our WhatsApp group, so we are on the third group, mashallah, Allah Mubarak. So I saw lots of new people, and so just a little introduction about myself. My name is Hafsa Qureshey. I am a mother of 3, Allahumma barik. I have been in this field for 14 years now, and my first was a very traumatic C-section. Almost this year, it's going to be 17 years since I had my C-section. And after that, I was like, nope, this is not how it's supposed to happen. I wanted to protect other women. So I changed my field completely, and I stepped into this field. And I am originally from Pakistan, born and brought up here in Kuwait. So I speak 3 languages. If anyone has any questions in any 3 languages. So if you have a question in English, of course, the session is going to be primarily in English. But should you have a question in Arabic, فلا تحاتون تقدر تسألوني أي أسئلة عندكم بالعربي أجاوبكم بالعربي بعد. اللغة حق الجلسة هذه تكون بالإنجليزي, بس إذا عندكم أي أسئلة بالعربي حياكم الله, إن شاء الله أجاوبكم. और अगर किसी के पास उर्दू में सवाल है तो आप लोग उर्दू में भी पूछ सकते हो, and I will be happy to answer उस सवाल का जवाब उर्दू में दूंगी इंशाल्लाह. All right, and so yeah, 13 years ago, alhamdulillah, I had my VBAC, which is a vaginal birth after a C-section. And a year before I had that, this is when I started to do everything here. Here in Kuwait, we get these professional trainings. So alhamdulillah, that you see on the screen is all that I have qualified in. And then there are some in progress, alhamdulillah, always a student, right? So yeah, I'm a certified childbirth educator. I am a Lamaster certified childbirth educator, postpartum doula, birth doula, VBAC advanced doula, a newborn care specialist, breastfeeding specialist, lactation educator, lactation trainer, and soon to be, inshallah, in the next few years, lactation consultant as well, bi'idhnillah, with your du'as. All right, so yep, this is who I am, and I help mothers from pregnancy, labor, birth, postpartum, breastfeeding, solids, weaning, toilet training. What did I miss? I think everything's there, right? And weaning off breastfeeding as well, alhamdulillah. So it's the whole thing, whatever parents need, right? It's not just the mother. I would like you all, if your husbands are around, please tell them to jump in and join in and be part of this virtual circle, all right? Because I want mamas and babas both to be here and feel the support that they need. Now, what are we going to talk about today? Again, the whole purpose of this gathering, this is the third one we're doing, is for us, it's a free session. I have a very busy schedule, so I just try to take out these time where I can help reach out to more of you in these free sessions as much as possible. So we're going to start with setting our intentions. And today I'm going to be talking a little bit about something that is affecting, first of all, me, and then I'm sure many of you out there, right? So we'll talk a little bit about that, all right? And I hope you feel that support that you need. So giving you the affirmations and any debriefing that could help, right? And then we'll have a sharing circle, which I've seen, mashallah, lots of sharing things have come across. So I'll be sharing my screen and going through all the stuff, birth experiences, positive, negative, everyone has shared in the link that I sent in the WhatsApp groups. And then we will move on to, I'll give you some basic tips that I give every time. And then we'll move on to the questions and answers, and there'll be a new link for that. So if anyone has a question, be ready to post it there. All right. So that's the agenda of how this is going to work today. Now, starting with setting our intentions. So first of all, think to yourself, I'm here today. Why am I here today? What is the purpose of me being present in this session today? Now, I kept this session in English because I've got the global community here. But my birth classes, I teach them in 3 separate languages. I teach them in Urdu, I teach them in English, and I do teach them in Arabic as well. And then I have those groups separated. So today's is going to be more of a universal language, like I said. So apologies for anyone that's struggling a little bit. If there is anything specific you want me to explain in the language of your preference, let me know. All right, we'll do that at the end. All right, now, hard times, subhanallah. So I wanted to start with my intention. First of all, my intention was to do a birth circle after Ramadan. But little did I know, this birth circle, my intention completely, like the intention to do it was there, but what did I want to talk about? That changed, well, let's say exactly a month ago. So yesterday, Saturday, 4 weeks ago, we woke up to the world turning into chaos. And me living where I am in Kuwait at the moment, we are deep into it. Okay, so we are facing it. I would say the first couple of weeks were harder, but subhanAllah, humans are very adaptable. Gradually, for me at least, it doesn't have to be for you, it has become the new normal, right? And we have started to accept it, and we have started to adapt to it and look at the positives from it, which is where one of my dear friends, she said, don't look at what's missing, rather look at what we can grab from it. And I think that perspective has really helped me. And inshallah, of course, the du'as are there, the prayers are there. We need more of them from the ummah, that all of this unrest, the chaos settles down. But we need support. So imagine, I'm just imagining, I'm not pregnant here, right? My last baby is 8 years old, Allahumma barik, right? My mission and vision of my life is to support moms. So I'm imagining, and I'm supporting also, women who are either pregnant, who are due soon anytime, who are breastfeeding during these chaotic times. That uncertainty, that fear, that unknown, that not knowing what to expect, right? Subhanallah, it can have even more of an impact to when we are more vulnerable, right? And subhanallah, a woman is the most vulnerable during these stages. And this is not me demeaning your strength. We are incredibly strong, but it's acknowledging and validating, wahnan ala wahn. When my Allah subhanahu wa ta'ala, he also said that it's hardship on hardship, and then we have chaos happening in the world, then just imagine what we are feeling. So I want you all to take a moment, give yourself that ease that, okay, if I'm not doing okay, if I am going through all the hardships, all the hormonal up and downs, the postpartum tears and everything, or the pregnancy hardships, or the breastfeeding struggles, amidst all of this uncertainty and unrest in the world at the moment, there's nothing wrong with me. This is hard. So if I need the support, if I need to be amongst people who also feel the same, just so I feel validated, and there's nothing wrong in that, right? So how many of you, and for that you guys can just pop into the chat, in the public chat here. So the public chat, you can find it on the top left, since most of you are on your phone. On the top left, there's this little person thing. You click there, you'll find the public chat, right? Or if you're on your laptop, it's right in front of you, right? So how many of you are feeling exactly what I described? That already with the hardships of motherhood, the vulnerability of motherhood, on top of it, the pregnancy, the labor, the birth, the postpartum, the breastfeeding, all of this feels harder. Just so you know you aren't alone. Yes, hardship over hardship for sure, right? And then I'm going to say a few words that might help you in maintaining because that's what's helping me. Believe me, I'm in with you. The only difference is I am working and trying to support all of you. I'm not in the breastfeeding postpartum pregnancy state myself, right? So I probably can't relate 100%, right? So give me the slack there, please. But the fact that I know that you're there and I want to support you, that part's there. Yep, it is hard. So I just want to add there that there is another ayah of the Quran. فَإِنَّ مَعَ الْعُسْرِ يُسْرًا. So we are living through the usr right now, the hard part. But my Allah's promise is after every hardship does come ease, right? And this is where the beautiful dua of Musa alayhi salam, رَبِّ إِنِّي لِمَا أَنزَلْتَ إِلَيَّ مِنْ خَيْرٍ فَقِيرٍ. That dua is very, very special. That we're in need. We're desperate for whatever khair is there for us out there. So holding on tight. And in Ramadan, I did I loved it myself. And I'm sure those that attended it benefited from it themselves as well. I did a parents dua free workshop. And it's there. It's on my YouTube. So if you're on my WhatsApp group, I'll share my YouTube channel link and you'll get everything. And that's something new I started in Ramadan, is writing down my daily dua, right? And I think right now, obviously, my dua is very up there. We know what we want, we are asking for. So I just want you to know that reaching out and wanting support, knowing it's hard, and it all feeling harder than it should, there's nothing wrong in that, and there's nothing wrong with you. So taking a moment, giving yourself that support that you need. It could be speaking to a therapist. It could be joining a support group on WhatsApp. It could be signing up for birth classes so you have that support from a professional. It could be meeting in person, right? Circles in person. I wish I could do those. But there's all of you here from all over the world right now. And I wish I could do them in person and literally hold your hands and give you hugs to make sure that you feel that touch, right? You feel that you aren't alone. So just understand that. So my intention for today was this. So setting yourself your intentions, try to do it every single day. Wake up. That's what I'm doing. My way of coping, my coping mechanism. I was sharing this with our professionals group as well. My coping mechanism is, of course, the dhikr, especially istighfar. Holding on tight to the morning and evening du'as. I don't think they ever felt so meaningful that they feel now, because those du'as are for protection, right? And in this uncertainty, if anything we need is the surety that Allah is going to protect us, right? So that surety I'm getting from my morning and evening dua. So if you have not been consistent on those, maybe that is something could be your takeaway from today. Okay. And then of course, take my coping mechanism is taking one day at a time, right? I don't know what tomorrow holds. I can't control what tomorrow holds. I can't control what tonight holds. I went to bed last night early, but I woke up with 2 hours of sleep because there were sirens blaring 5-6 times in the night, right? So just setting small goals, very purified, multiple intentions, trying your best, reaching out for support, holding on to the du'as, being firm on your morning and evening azkar. This is what I want you to take away from today, at least. All right. Now I'm going to share my screen and go to the sharing circle. So some of you have shared beautifully, and I'm going to go through and read them with you. So let me just copy the link and pop it into the chat here. All right. And I'm going to quickly pop it into the WhatsApp groups as well. My 3 main groups. I'm not going to send them other places. So if you're not in my group, make sure you just take it from the chat here. Right? I'm just going to share my screen and share what beautiful things have come through. Some have been questions. I'm not answering questions now, and you guys know that because this was the sharing part. But I am going to be, where's the next one? Wait, so online, I just shared here. Shared here. And there I am. 1 second, I'm just going to forward it. Here we go. Okay, so I've sent the link in the WhatsApp group, so if it's easier for you to do that, or you can just scan the QR code you see in front of you. All right, or you go into the public chat of this site live session and just click there. If you haven't had a chance to share, you want to do that. So I'm going to start with present. Let me write down present here. And I'm going to start reading out all the things that have been shared so far. So there you go. You guys can see now my screen, and you've got the code, QR code, if you still haven't had a chance to join, or just go to slido.com and enter this code that you see here. Okay. So I'm going to start from the bottom and come all the way to the top. Okay. So if anyone new queries are coming, they will be on the top. All right. So first of all, she's thanking you. Thank you for supporting my breastfeeding journey. I'm glad that you want to share that and you felt supported at that time. Now, I do see some questions, common issues during labor, baby heartbeat, amniotic fluid. How should one respond to those to make informed decisions? Now, in the next couple of slides, after I go back to the main presentation, I'm going to give you a tool to make informed decisions. Now, for that tool as well, you need knowledge. So stick till the end. I'll tell you how to get that knowledge. Okay? How to overcome the fear of normal delivery, first-time mother. Again, I could put this in the question, but I like this to be a very vague one. Fear of the unknown. All right? There is a lot to do with that. So fear of the unknown can really overwhelm us when we don't know what to expect. So for example, let me give you a very easy example. I sit in my car and I leave my house, right? And I just turn across the street. If I don't have my Google Maps, if I don't have a destination, if I don't know where I'm going, of course I'm going to be scared. Oh my God, why am I in this car? What am I doing? I'll be afraid. I'll be uncertain. I'll feel intimidated. I would feel confused, probably frustrated and angry that, I just got off without any instructions, without any maps, without any navigation. So especially if you're a first-time mother, I highly, highly recommend getting your birth navigation sorted. And that would be through educating yourself by taking childbirth education classes. So when you know what to expect, when you know what the stages of labor are, when you know what's going to be happening, how to manage labor, how to go through what's the natural pain management tools, what are the true complications, what are interventions that are done like, very normal routine, right? Which should not be done, which could create a positive birth into a negative one, right? That helps you overcome your fear. Okay. What to do if it's found meconium, I think she's talking about. Yeah. So that is a question. So we'll talk about that. I recently found out that I'm pregnant. It's my 6th week and I'm confused because Elder is asking me to book flow. All right. So that one comes into the questions. Thanks to your classes, I was able to have a very strong, positive birth despite a very challenging birth environment. Thank you. Want to share that with everyone. That's the kind of sharing I'm looking at. So thank you so much for sharing that. Right. And indeed, so yes, you can when you have control, when you are the one who's leading the show, not the doctor, not the husband, not the father-in-law or the mother-in-law or the mother or whoever has an influence. It is you who's control. This is where things happen. This is where change can happen, even in a very negative or a very non-pro natural environment. Okay, and that's not one mother. I mean, I've helped in the last 14 years over 1,500 moms, 1,500 moms. All right, and this is one of them. Okay, the birthing ball, not the peanut. You want the circle. You want the ball. Peanut ball is not a ball. Okay, and the exercises are, the video of the exercises is included in the classes. What exercises you should be doing. I just want to share. Please don't suffer in silence for postpartum challenges, because that was the sabse mushkil part of my parenthood, even more than 2 days labor. So this mama had 2 days of labor. I think I might know who this one is. I was just talking to her this morning. Subhanallah. And she is having the struggles of postpartum, and she is reaching out for support. And I'm glad she is, right? And just this morning, I passed on numbers of professional therapists, and there's nothing wrong in seeking mental health therapy. Just like we get physically ill, taking mental health support, which is considered a very taboo topic, which I'm glad it's kind of changing, which reminds me, I'm going to be doing an enriching talk. So these are virtual sharing circles. See, I'm reading out what you guys have shared. But I do these talks, these podcast type talks, which you also can find on my Instagram, by the way. On my YouTube, by the way. So I'm going to be having one with somebody who's going to exactly talk about mental health, right? Motherhood and mental health. So that's coming up. Stay tuned. All right, I'm going to answer the questions later. Your belief, your love, your support, your way of teaching, I haven't ever seen. Love you for the sake of Allah. Love you back, Hayati. I'm so glad. I'm glad it is something that you have benefited from. And I'm glad it is, this is what I want. I want mamas to feel supported. I'm not how to overcome the fear. I'm so sorry the doctor scolded you. Yes, these things should be first explained or make the patient count. Now, a vaginal exam should not be done. An internal exam should not be done. This is what I teach in just my 3rd live session. So our live sessions are over 10 classes, right? And that is something we cover visually. Like I have my pelvis, right? I use my props. So this is my newest one. This is a pelvis, the vaginal muscles, how to prepare, all of that we do cover just in the 3rd one. So I'm so sorry that she did that. So I'm going to answer this as a question. How should you prepare? I would ideally at 37 weeks, not the best time to educate yourself because again, like I said, it's over 10 weeks. I would appreciate if every mother can reach out as early in pregnancy as possible. So we're working together to overcome this. But yeah, I think affirmations, breathing exercises, relaxing your muscles, and simply having the autonomy to say, no, you don't need one, right? That part. Time to go to, all of this is covered in the classes. My thoughts on water birth. Water is an excellent pain relief. Excellent pain relief, right? Still scared about birth, so let's talk. Even after you've taken the live sessions, no problem. If you still feel the fear is there, then you need to debrief. The first session, go back to the first class and debrief. Writing down and taking out and do your parent journal exercises, the activities. They really help in that mumble jumble in the brain, that ball of wool that is all, it helps to kind of wind it up neatly into a neat, nice ball. All right. So do them. Or even if that doesn't help, then speaking to a professional therapist was what helped me, because after my traumatic first C-section, I went into severe PTSD, and it took me time to work through it before I could even prepare myself for a VBAC. Okay. Hypnobirthing is a completely different field. It is, again, a lot about debriefing, a lot about talking yourself through in affirmations. I do provide some sort resources for it, like positive affirmations. You can listen to it. That's part of my resources, but I don't actively do hypnobirthing in my classes. No. Nutrition is in detail in I will try to talk about that in the questions. Okay, since this is about sharing, I'll leave my question for next time. Thank you for understanding the assignment. But just want to share that birth classes changed my husband's way of support. He finally knew how to help because he was lost too. Now, how many husbands are there here right now? I wonder. I want you to understand that, yes, I totally acknowledge and understand it's you who's going through all the changes. But at the same time, this Baba wants to help. And he's becoming a Baba for the first time, or probably if you're going for a VBAC, wanting to go through that experience the first time. Wallahu alam. And we have expectations as women. We're expecting that, yeah, my husband's going to support me. The poor dude is like, how am I going to do that? How am I going to support her? I need to know how to support her too. I need the tools as well. Right? So, not just you. This helps. I remember the founder of Amani Birth, Aisha Al-Hajjar. I love her, absolutely. An amazing, amazing mentor. When I was doing the training with her, she said that she used to teach couples and everything, and I'm witness to that, because I felt the same, that with some of my moms and dads, that taking the classes together actually brought them closer as a couple, because that communication, you learn how to communicate when you do the activities that I tell you to do every single week, right? And you communicate it to each other and you share it with each other, it makes a big difference. Okay. There you go. That's the next question. How to get him involved? Bring him to the first class. It's my duty to make sure he comes back. Your part is bring him to the first one. And we women, we can convince them. Believe me, we know we have very good convincing skills. We can convince them to get our favorite things. We can convince them to this. Okay. And I have a testimonial about the C-section part, that if he's thinking the C-section is the safest point, then maybe enough awareness and knowledge about the C-section is important, because C-section is a major abdominal surgery, and I'm still living with side effects from it 17 years later, right? It is not the natural way. Okay, the way Allah subhanahu wa ta'ala has designed us, C-section should be for true complications. So alhamdulillah for C-sections about when it's needed, but it should not be the way. And I've had so many that came into my classes knowing that I'm going to have a C-section, and their minds completely changed, subhanallah, right? And yes, his is because of his lack of knowledge. So there you go. You bring him in to the first class. I'll make sure he comes back. I just want to share I'm coming with a VBAC background and so much looking forward to learning that what can help with my process, inshallah. Inshallah. So you are looking into achieving a vaginal birth after a C-section, inshallah, and you're looking forward that can help you in this. And my VBAC is a topic very close to me. I've personally helped women, countless women. I've lost count. I'm one of them. I'm a VBAC mother myself, by the way, so I can really relate the emotion part as well, right? So I've helped countless women with one VBAC, so after one C-section, too many, like countless now as well. I think I counted up to 200, 300, and then I lost count, who had a VBAC after 2 C-sections. Over quite a few actually now, and I'm trying to think. I can count on 2 hands now. Women who've had a VBAC after 3 C-sections. And then there has been 2, yes, who had a VBAC after 4 C-sections as well. Alhamdulillah, Allahumma barik. Okay. So yeah, alhamdulillah. CB is the best way of taking charge of your birth. If you don't want to go into the dark hole without light and supporting team, this is your way to go. Otherwise, other women give birth too, and their babies come to home, but they don't just feel happy and empowered about it. right? I've had moms who walked out happy from their C-section, even as long as it's an empowering experience with no trauma. Birth should not be traumatic. They leave the hospital with confusion for years and bonding difficulty with partner and their own child. Yes, I'm witness to that myself. Just want to share that my first birth was traumatic because of 14 hours of labor, starting with natural pain, getting induced, and being alone in labor. I'm so sorry. No woman should be alone because family wasn't around, only to find grade 2 meconium and amniotic fluid, which was a threat sign for the doctor and went to C-section. I'm just imagining your mental state, right? It was traumatic. It was a long labor. You're left alone. So that kind of was not the grounds for oxytocin, the love hormone, the hormone we need, right, for labor to progress. And if it is increasing your adrenaline, your stress instead of your oxytocin, then that does get passed on to the baby. And that can put the baby to distress. And of course, then the baby is like, how do I release my distress? And many babies end up passing meconium, subhanAllah. But if you don't get a VBAC supporting doctor or midwife, it will revoke their license for patient multiple be higher since we can't go ahead. It's a bit scary doing it all alone. I'm not saying do it all alone. You might not find the 100% supportive care providers, but when you're taking the autonomy of making step-by-step decisions, right? Your decision of when you want to hand yourself over to the healthcare provider who is not supportive, that part's your decision. There was a doctor, I'm trying to remember his name, the full name, Michael something. He said the first intervention a pregnant woman does to herself, a healthy pregnant woman, a low-risk pregnant woman, is when she steps out of her own home in early labor, right? So waiting for labor to progress, going in, reducing the time where you would be exposed to interventions and possible complications. But I'm here because motherhood, pregnancy, and everything scares me. So I'm here out of curiosity and to find gentle clarity. I'm so glad you're here, right? So the dua, Allahumma arina al-haqqa warzuqna ittiba'ahu. So maybe recite the dua, and that may Allah open your mind and vision and heart towards this, inshallah. I'm glad you're here, by the way. First time mom, you got a C-section. I want to avoid infertility. What is your suggestion? My suggestion is your baby 7 months old. Aim for a gap of 18 months between births, right? Ideally 2 years between births, right? Use this time now to heal physically, mentally, and emotionally. And then plan your VBAC and then come back to me. And I will support you in this journey, inshallah. I'm not going to be talking about medications here. All right, we're done with the sharing part. So let's go back to our sharing circle. We're done with the sharing circle. Now, coming back to this, quite a few of the questions were related to nutrition. What can they can do to make the placenta stronger, the water bag stronger? I don't know. There were a few random questions here and there. Your nutrition plays a huge role. Allah subhanahu wa ta'ala has given you 9 long months, right? To be able to prepare yourself, to be able to get ready for the big day. Think of it, and the best example that Amani Birth uses, which I absolutely love, is it's as though you're trying to climb a mountain. And the example I like to use is as though you're running a marathon or as though you're preparing for an exam. Would you show up for your exam unprepared without even opening a book, knowing that you have an exam? Right? Like my son, he is supposed to be sitting exams. I don't know what's going to happen with the world right now, in a month's time. And he's preparing. He doesn't care the chaos that's happening outside. He doesn't know if they're going to happen or what, but he is preparing. And that is the part we can do. Preparation is key, right? And in this preparation, your power is knowledge. So knowledge is power and preparation is key. When you take both of these things hand in hand, this is what it helps. Mitigate risk factors. Complications arise, things happen, things go wrong when there are risks. Sah? Right? So we are mitigating and reducing these risk factors by good nutrition. Right? So following through with the right proteins and hydration and basically anything and everything you need to mitigate, to reduce these risk factors. And then your daily exercise. Some of you asked this question, and I hope this answer is that. In my early weeks of pregnancy, I'm supposed to be shisma. I'm told not to walk too fast and all of that. No, we don't do that, right? We are supposed to be basically looking into and focusing on the fact that pregnancy is a natural event of life. You are pregnant, you are not sick. So just like you would be, an active pregnancy basically is going to help result in an active birth. You're preparing for that marathon. You're preparing for that big labor day. And you cannot possibly do that if you haven't been active, if you haven't built your stamina. So your daily exercise, starting from day one, if there's it's a low risk, all okay pregnancy, is from day one. Not when you are 36 weeks or 34 weeks or in your last, oh yeah, I need to start walking. I'm due in 2 weeks. La, 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 la. Allah gave you 9 months, remember? To prepare for that marathon, for that exam. Why did you leave it for the last 2 weeks? Don't do that. Do not do that at all. Okay? So making sure you're doing your daily exercises, you're working on your nutrition, the right protein, so 80 to 100 grams of protein every single day. Those of you that have signed up for the classes, you will get all how to get that protein, all the guidelines and tools. And I do take diet diaries. I will tell you to give me what you've eaten for a week, and I'll get back to you on that. Okay? And then informed decision making. How do you make the informed decision? That was another question one of you did in the sharing circle. How do you make the informed decision? How do you know what to do? Should this happen, or should that happen, or should the amniotic fluid go lower, or should the baby make it past meconium? How do you make that informed decision? Right? So for that, of course, the first thing is obviously use your brain, and that brain algorithm you see on the screen right now. So you look into the benefits. What are the benefits of any procedure or any decision that you're making? How will it positively impact my labor? Right? I've reached my due date. Oh, let's go and get induced because, oh my God, if I wait 1 more week, my baby is like Cinderella's pumpkin. It's going to turn into a pumpkin at the stroke of 12. I'm sorry, no. That's not what happens. My third baby, she was born at 41 plus 6, almost 42 weeks. Right? But was I waiting blindly? No. So this is where the informed decision came into play. I was weighing the risks and the benefits. Right? What are the risks of me waiting, for example? What are the risks of me changing my doctor at 41 weeks? What are the risks if I refuse induction, for example? All right? How is it going to negatively impact me? Right? And of course, this is where you need your knowledge. And alhamdulillah, it's 10 weeks of education, remember? So you will get that knowledge. And what are the alternatives? What can I do? How do I bring all this on naturally? How do I make it work without having that unnatural influence? Are there other options that could help me get the results I want? And then what is my intuition saying? For istikhara, I believe strongly on the power of istikhara. Start doing it yourself. Teach it to your kids. Make it a habitual act in your household. Listen to your gut. Make your connection with Allah subhanahu wa ta'ala strong. Right? Confused? Ya Allah, please help me. That is what istikhara is about. I'm confused. I don't know. Right? Maybe some of you were doing istikhara and that is why you were sitting here today. Because you didn't know what to do, and probably you get clarity. Okay, maybe this was a sign and I need to go ahead and sign up myself for birth classes. Right? And then what if you do nothing? What if you just wait? What if you just need time? Is there anything wrong with me waiting? Breaking this down to make the informed decision is what's going to help you, inshallah. Okay? And this is why this preparation matters a lot. Because a lot of us are dealing with fear. I was, right? My mother had 4 C-sections. My sister had 4 C-sections. I had 1. I felt like, okay, we're doomed, right? Halas, this is the way it's supposed to be. But then I was like, no, it is not supposed to be this way. It's not, because mine was hell traumatic. Why? Like, motherhood was supposed to be beautiful. I felt robbed from the beauty of the motherhood, from the bond that I should have had. That breastfeeding journey was sabotaged. I've been there. I faced it. I can relate. So this was not right. So this is where I was like, okay, this needs to be fixed. And again, the whole thing, istikhara, getting myself up. I was a mother like one of you. I joined birth classes and I'm completely lost. And then I realized, oh, okay, I can do it. I can try for a VBAC. And I changed 18 doctors. Because my VBAC happened almost, 13 years ago? So I changed the 18 doctors 14 years ago, even before I conceived. Because I was so adamant. Now I had the fact, I had the knowledge, I had the enlightenment. I was ready to leave no stone unturned. If a doctor was saying, لا, you're going to kill yourself or your baby, and what are you doing? It's risky. Oh my God, it's risky. Well, let me tell you, all the VBAC moms listening to me now, the risk of uterine rupture or your previous stitches opening is less than 0.2% based on the latest recommendations. So that means 99.8% that is not going to happen. What is my common sense? My brain, right? Human have a brain. What does my brain tell me? Should I look at the 0.2 and live in that fear? Or is the 99.8% enough for me? Well, of course. If this 0.2 is going to give me the trauma of my life, why can't I focus on the 99.8 instead? This is the shift that I went through. And this is the shift I want you all to experience. And this is why when 16 of these doctors would not let me have a trial of labor that I deserved, I talked with my feet. I walked out. So when you have the knowledge, you feel strong enough and do not get fear-mongered. One of them was like, you have to sign this. I'm like, yeah, sure, yalla, atini. You made me sign the C-section consent form. How many of you have had a C-section? Did you ever read what you signed? How many of you did that? I know I didn't. Well, I didn't even sign it. My husband did. And then, when I had my gallstone surgery, and I was like, okay, now I have the kind of time to read this consent form of a surgical procedure. Obviously, it would have been a bit different for a C-section. And I remember even then, the doctor that brought that paper to me, they were like, yalla khalas, waqi wa khali. I'm like, no, give me half an hour. This little booklet of, I think it was 6 pages, I need to read. And once I read it, it's all like, I agree to all terms and conditions. It was that kind of situation. That you're agreeing to all these scary things that are written in fine text that no one explains to you. Well, then, if I'm going for the 99.8 by having to sign something, well, why not? Why am I doing something wrong? No, because now I have the knowledge, the information, and this knowledge is not just knowledge that Hafsa's throwing at you or Amani Bird's throwing at you. This is evidence-based knowledge backed by WHO, backed by American College of Obstetricians and Gynecology, backed by VBAC facts. So this knowledge, this preparation helps reduce the fear and anxiety because we understand things, right? We need that. Because anxiety, the unknown, I think part of this chaos happening in the world, the biggest reason of my anxiety, personal anxiety, living in the middle of it, in the middle of the crossfire, basically, is the fear of the unknown. I don't know what's going to happen. This is what's fueling my anxiety. If I know, I probably won't be so overwhelmed. Same goes for birth. And then there you go. It empowers you. When you're empowered, you're not traumatized to make the informed decisions. It helps communicate. I give you tips. I'll tell you, okay, this is how you speak to your doctor. Because I've done that. I pass on exactly how I spoke to 18 doctors. And it was a learning process. The first one, I probably was timid and they're like, okay, all right, yeah, bye. By the time I reached my 14, 15 doctor, I was like, okay, shukran. Bye. The tone changed. My body language changed probably. All right. So it improved my communication. And then when I did go with a birth plan with someone who's allowing me for a trial, I knew what the positives were that I had to grab onto. And that makes a big difference as well. Right? Because a positive and personalized birth experience is very different when you are fully prepared. Subhanallah. All right. And now I'm going to give you the next place where you can share your link and you can ask your questions. So let me just post the link again. I think it's the same one. Yeah, it's the same one. You just join the same link. And I'm going to wait. I'm going to present and have your questions. So now I'm going to have the last, say, 15 minutes. So now you can ask your questions before I leave with you how to what the birth classes are and what it entails. This is going to be the last part. I don't want this session to be about marketing myself, right? I want to ask your questions. Answer your questions, basically. Okay. Where to find midwives in Karachi, Pakistan who arrange things at home and help in birth? I have been working with, I'm from Pakistan. I'm from Karachi itself. I have over, I don't know, I think 400, 500 moms, 300, not 500. I think there are between 300 to 400 moms that I've helped personally in Karachi. Currently, in all of Pakistan, there is no certified midwife that I can recommend. So there is none, right? But that does not mean you can't have a positive birth experience. I do not recommend free birthing or birthing yourself by yourself at home. I do not recommend that. Okay. Please recommend any book helpful for a VBAC journey. I would say the Amani Birth book, which is available everywhere now. You can get it, the online version. You can get the printed version. That's a really good book to prepare you for birth. As a VBAC, consider yourself, mark my golden words, consider every VBAC mother. I want you all to consider yourself as though you're giving birth for the first time. Khalas. Yes, you have a previous scar. Do get informed about the danger signs to watch out for, and there are very few, and we cover them when we cover complications and stuff, and that's it. But in general, a good book preparing you for birth, a natural birth, low intervention birth, going with the autonomy of your body, because Allah, fatabarakallahu, ahsanul khaliqin. Allah has created you in the best form. Ahsani taqweem, right? So trust you, as women, we're created to do this. Don't doubt Allah's creation that, oh my God, I can't do it. You can, of course you can. Women have been doing it since Hawa alayhi salam till now. Right? So having that faith in Allah's creation that I'm created complete. Okay? Okay, next question. Yeah, we'll keep bringing the questions. All right. How to prepare my body for breastfeeding? Excellent. I love this question because I love breastfeeding. So breastfeeding, prepare yourself now in pregnancy. Don't wait for after the baby's born for the breastfeeding preparation. All right. So breastfeeding preparation starts now. All right. So having a birth plan where you do mention everything that you need for postpartum immediately after birth, that first golden hour, skin to skin, learn the right latching. And I have the perfect workshop. It's a 2-hour workshop focused to give you everything that you need to start breastfeeding. It's called Breastfeeding the Right Start, happening in 2 weeks time. Yeah, next month in 2 weeks time. So if you've not been following me yet, just do follow me on Instagram and you will find the link to register there. How to overcome PPD physically and emotionally. First of all, a big virtual hug to you. I'm so sorry you're going through it. And I'm glad that you've recognized it. That's the first step. That you're like, okay, something's not okay. I'm going through postpartum depression. Now, the second step is you want to overcome it. First step is recognition. Second step is the willingness, I don't know. All right, to overcome it. Some would say, I have PPD, khalas. No, your question says how to overcome it. So give yourself a second pat on your back. Right? Now, answering your question, third thing, you recognize that it has impacted you physically and emotionally. That's a third pat in your back, because sometimes we fail to recognize the signs. Now, how to overcome it, the tool that you need is, for if it is diagnosed as PPD, is to make sure you speak to a professional therapist. I'm not one. I'm happy to hear you out the debriefing part, but proper healing process and not one session, right? Just like one dose of antibiotics is not going to kill a bacterial infection. In fact, taking one and stopping the rest can actually make it come back with more severity. Regular sessions, trauma-informed therapy if you can, even more, because PPD is usually related with, if it's related rather, with birth trauma. Okay. Previous experience, I dilated 10 centimeters, labored to 40 and ended up with a C-section. Does dilate? Yep, it does. So the 10 centimeters, think of it, the best example I like to give, because I've lived in Oman, by the way. My C-section happened when I was living there. We used to have in Salalah, I was living in this beautiful city called Salalah. We used to have wadis there, right? Where it was dry most of the year. And then when it rained during the beautiful monsoon season, the wadi would flow. And this wadi, we would know that, okay, you're not supposed to be driving, or you're supposed to be stopping here because the wadi is going to flow because it's raining. And how would we know it's going to flow from here? It's because it had carved the path. The path was previously carved from the previous monsoon. So the analogy that immediately came to my mind for you is this 10 centimeters. Your body did it. It will remember the fact that it labored. Right? SubhanAllah. And then it would help you, inshallah, to help increasing your chance of a VBAC. But please do debrief if there is any trauma, because 48 hours of labor and a C-section, it's very relatable for me, by the way. My story is very similar. And it was not traumatic. So yeah, it will definitely help increase your chance of a VBAC, but please, please, please heal from it first. Okay, Hubbi? What did you do with meconium spasm? So depending on the grade of meconium, so the first grade is like yellowish, then there's greenish, and then there's blackish. And how is it impacting the well-being of the baby? So meconium itself is not the risk factor. It's the meconium aspiration. And the baby aspires, or the asphyxia of a newborn happens when there is distress. As external factor, something is stressing the baby, which causes the baby to breathe inside. Okay? So in either of the cases, I don't care whether it's 1, 2, 3, I would want the mother to be able to know that the baby is doing okay. So she needs to go and get well-being checks, or be able to get the baby checked frequently enough. As long as the baby is doing fine, we continue to wait. Right? At any point, there is without interventions, because interventions would increase the risk of meconium aspiration, which obviously is extremely, extremely dangerous. Okay? 32 weeks, you can, my classes start in 2 days. So it's not too late. You have the time. Jump on board. Okay? I would only recommend nipple stimulation if it's like you are well past. Like, I wouldn't do it if you don't want to overstimulate, but nipple stimulation, where's my nipple? So nipple stimulation, either with your hand, with a pump, can help release oxytocin, but it should be releasing oxytocin, not making you uncomfortable. Okay? Which can help increase the oxytocin, but you need to make sure other factors align as well. I've heard she helps only if you can counter arguments intelligently and change your tone. What should I do? Educate yourself. So you've selected a doctor with a high VBAC rate, and you know how to navigate with her. Well, there you go. Have a solid birth plan. Be ready. Know what to do. Be educated. And there you go. You can definitely navigate it. Can I start solids from maybe? No. Starting solids is at 6 months. Nothing but breast milk for the first 6 months of their life, even if they show sign of readiness. Baby's gut is not developed enough. 6 months, the first 6 months, only breast milk, nothing herbal, nothing. Breast milk has everything the baby needs. Is home delivery possible with 2 people, your husband, and if he's a doctor, is if he's obstetrician, if he's done births, if he can manage birth, if he knows what are the danger signs, when to transfer or not. Yeah, I mean, it's like having a doctor with you at home, right? Does he have everything that's needed to be it? That needs to be your decision. He would end up being your primary care provider, right? So if he's ready to do that, why not? Low amniotic fluid at 37 weeks. No, and how is that low amniotic fluid impacting the well-being of the baby? You need to see that. And how low is it? Right? Is this important? Yes. I would not want a mother to be laboring alone. I mean, but that someone needs to be not a stressful person. So it needs to be someone supportive. Cervical cerclage in both pregnancy. She's pregnant with second trying for a VBAC. Does she say? Yeah, of course she does stand up. Cervical cerclage does not make natural birth impossible. Natural waist-induced labor, I would not. The best way is waiting, and no one stays pregnant forever. I've had moms who gave birth at 42, 44 weeks, right? Obviously not waiting blindly. What are some signs after spending time in early labor to go home? So you watch out for signs. You're looking for, so labor has stages, right? You're looking at signs. So depending on what you decide, every couple decides differently. So if you want to go in transition stage, so it needs to be the transition signs. If you go in late active stage, it needs to be those signs. If you go ready to push, it needs to be the pushing signs. In session 3, so we introduce the labor stage, and in session 5, I break down each of the stages of labor, what to do, how the husband should be supporting you, what things can help you navigate each stage of labor. Okay. Navigate heartburn after each meal. That's a very common one. Usually the pregnancy hormones are to blame. So make sure you're taking smaller meals, reevaluate what you're eating, spicy foods, sometimes not walking. So make sure you're doing etiquette exercise as well. Trying the natural remedies. I can't share them here because they're part of the copyright information in the course itself. So in the course, you get this 172-page guide parent journal, which has 12 pages of natural remedies for all these common side effects that we face, like nausea. There's like 20 things you can do naturally, heartburn, leg pain, cramps, everything basically, right? Anything, the common discomforts, okay? Do you recommend epidural for VBAC candidates? Do you think it gives the edge by letting moms have rest? And I can't say yes or no. This is not a yes or no answer. It needs to be case by case, right? Epidural has its pros and cons, right? It is an intervention, right? And can women do without it? Of course they can. Is it mandatory? No, it isn't. Okay. Meconium because of weak placenta? How are we defining weak? That's my question. How do we know the weak placenta is weak? What is a weak placenta? That is not a terminology that I've ever seen used. Okay. What is classifying this placenta to become weak? All right. So we need to keep that in mind. All right. I think we are good with time, and we have answered lots of questions. Alhamdulillah. Okay. So back to this. And right now, surrounding yourself with positive affirmations, right? Walking through and surrounding, like I told you, one of my best friends, one of my very special mamas, I loved the affirmation she gave me, which helped me with my coping mechanism during these times, right? So my question would be, how are we? So one of you asked about hypnobirthing, right? So hypnobirthing is basically the positive affirmations, right? Surrounding yourself, toning your body, right? For birth, right? Especially nowadays, and even those same things can help you with breastfeeding, because the hormones needed for labor and birth are what is what we need for pregnancy, for breastfeeding. The same. It's oxytocin, which helps our milk supply. It's oxytocin, which helps labor progress. It's oxytocin, which helps birth, right? And helps us feel good because it releases the feel good hormones, right? So this is what we need, right? So I just want you to just for 1 minute. It's not going to be longer than 1 minute, okay? that just repeat after me. Just I'm going to read these statements out, repeat after me, and repeat them again and again if needed. That my body was designed with wisdom. I can trust it. And it was designed by the most wise, my Allah. Each wave of contraction I feel has a beautiful purpose, even when it feels hard. I'm growing life, or I'm nursing life with strength and patience. It is okay to slow down if I need to. Resting is a very important part of pregnancy, but not the part. Pregnancy is supposed to be a good balance between rest and activity. My baby and I, we're working together. We're working together in labor. We're working together in this nursing. I release fear and make space for trust. I put faith in my body's ability to birth and nurse this child. Allah subhanahu wa ta'ala chose me for this journey. I am capable. I can do it. I was designed by the perfect designer. With every breath, I bring calm to myself and my baby. My body knows how to nourish my baby. This hard moment, this painful latch is temporary, even if it feels overwhelming. I am enough for my baby. Every drop of this liquid gold is valuable, even if my baby is getting a few drops only. Most importantly, it is okay to ask for help and take breaks. I choose gentleness from myself today. That is one I'm saying myself. My presence is more powerful than perfection, because perfection is the sifa of Jannah. It's a virtue of Jannah. This world is not supposed to be perfect. The perfect Jannah is waiting for us. Ya Allah, please put barakah in this effort. I'm going to start my daily du'as. I don't have to do this perfectly. I just need to do it faithfully, with complete faith in the divine creator, my Allah. Hard does not mean I'm doing something wrong. Wahn ala wahn is the acknowledgement and validation my Allah gave me. I can take this one breath, one moment, one day at a time. And my Allah is with me in every difficulty. And He has promised me that ease will come, just as it always has, after every difficulty. And I'm stronger than this hard moment. And I hope these affirmations were beautiful for you and positive for you. And I hope this is something that you will carry and just made you feel better, even if it is for this moment. Okay? And these are the promises by Allah. لَقَدْ خَلَقْنَا الْإِنسَانَ فِي أَحْسَنِ تَقْوِيمٍ. You are created in the best design. So have faith in this design. Trust this design. Trust the Creator. Connect with the Creator. Make dua for every single stage and step of motherhood. All right? And these are the birth classes I was talking about. So in the birth classes, we talk about pregnancy nutrition, exercise, how to do pain management, what a mother needs. So this is me talking to the fathers, what they need in pregnancy and birth, how to make the informed decisions, birthing positions, laboring positions. I love that session. How to doctor shop, lots of personal tips and tricks. What are the stages of labor? How to help the hormones that play a role in it. We will write the birth plan. Like I will, in my birth plan writing part, it's part of the course. You will walk out with a birth plan. Okay. And then what's the role of each birth team member? So what's the role of your husband? What is he supposed to do? If your mom's a part of the team, what is she supposed to do? The nurse, the doula, the doctor, what are their roles? Okay. How to protect your birth environment, right? How to make labor easier, complications and common interventions. Let's be realistic. Nothing's perfect, right? We just said that. So what to do if this happens? Okay. And then of course, postpartum needs for a new mother and breastfeeding and baby care. It's almost 25 hours of comprehensive classes, right? We do them over 10 weeks for the Urdu group, over 5 weeks for the English group. I do have some English groups. Like it's basically 10 sessions. We can do them accordingly. There's continuous WhatsApp support, so you get added to a WhatsApp group, and then there's support where I share extra resources for your reading, for everything, pregnancy exercise videos, demonstrations, how to do them at home, right? Nutritional guidelines, my personal favorite recipes, of course, any emotional debriefing. I have had moms send me half an hour voice notes just to debrief. I'll be happy to help you with that. The live sessions are interactive. I have my video open. I have my babies and models and props and tools and the placenta and everything to help you visualize and learn every single thing, making it stick. All right. And so the props are there. For those of you that are trying for a VBAC, I have a whole VBAC, 2-hour VBAC workshop that I incorporated. So it's a bonus, free VBAC module that is included in all of the session at the end. And you get postpartum guidance, 172 page of handouts, and there is a special discounted price, and it's available in 3 languages, and it is the only Islamic faith. I mean, I'm certified from other places. I could be teaching Lamad, I could be teaching so much more, but I love this one especially for anyone who's educating themselves for the first time. Okay, and this is one lovely testimonial that she said she loved Hafsa's way of teaching, always very supportive, encouraging. I was genuinely scared. So one of you said your husband wants a C-section. So I was generally scared of the dark, unknowing surrounding childbirth from my little knowledge of it previously. I would have probably succumbed to an elective C-section, given how things are progressing in my pregnancy. I went from not being prepared at all for labor pains phase, welcoming this phase of my life during this course. I will make sure I make you love labor, by the way. Thankfully, after this course, I'm now much better prepared to understand and point out when the doctor is being overcautious and when she's hiding parts of information from me. I know exactly what I want from this birth instead of letting someone else's expectations rule my decisions. Very grateful to Hafsa for her undivided attention during the course and for answering my many questions without complaint in every single session. If I successfully achieve a vaginal birth, I will owe it mostly to the course and the guidance from me. All right, so these are some of the testimonials. And those of you asking for the breastfeeding workshop, there you go. It's on the 13th of April. Right, and this is the time it is going to be. I've tried to accommodate so that we have moms from New York, so EST, Eastern Time, GMT, UK time, Kuwait time, UAE time, Pakistan time. I hope I've covered it. It is recorded as well, by the way. So if anyone misses out, they can pop in. The best way to register is DM me on my Instagram that you can see. Wait, I have the QR code. And this is all about me. These are all the other workshops, specialized workshop I offer. There you go. You can scan this or hop onto this to get in touch with me. And we are done, alhamdulillah. So thank you, everybody that has managed to join us for the session today. Jazakumullahu alf khair. I hope this was beneficial for all of you. I truly enjoyed doing this with all of you here, alhamdulillah. And yeah, I hope you all walked away from this learning something new. Again, just reach out to me on this number that you see on the screen. Some questions came up. When is a good time to take my solid starts? Your baby's 3.5 months. You don't really need a lot of preparation, so you can take the solid starts workshop at 5 months when the baby's 5 months old, right? Pregnancy precautions, not much, right? Main thing is preparing yourself and mitigating it if you have any risk factor or any complication before. I've answered the epidural one. Yeah. I am so glad you found this beneficial. May Allah increase your knowledge, and I hope to hear from all of you soon. And the recording of this will be shared bi'idhnillah. All right. يعطيكم العافية جزاكم الله خيرا سبحان الله وبحمده سبحانك اللهم بحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك جزاكم الله خيرا السلام عليكم ورحمة الله وبركاته. And stay tuned for the next free session, which is going to be an enriching talk. I don't know when yet, so I will post about it. Stay in the WhatsApp group, by the way. So the one that I created for this event, that's where I announce everything. Okay. جزاكم الله خيرا. السلام عليكم.